Hi, I'm Dr. Peter Peng, dermatologist and dermatological surgeon from Taiwan. I opened my clinic from 22 years ago. Thanks to the previous experience of SARS in 2003, we have some experience. So the following is our policy in our clinic. Firstly, it's about the entry check. We do 4 things. Every patient is going to enter my clinic. First, we check the temperature with a forehead thermometer. If the temperature is over 37 degrees, we check again. If over 37 degrees twice, we recommended the patient to check in the hospital about the virus condition, and also sometimes for check for the virus content. The second one, we want to check the history of the patient through the ID card or national health card. We can check the travel history and contact history of this patient. The third one, everyone want to enter the clinic need a medical mask. And the fourth one, the patient's hands, we spray 75% alcohol to disinfection of their hands. Second part about clinical environment disinfection. We use 75% of ethanol and hypochlorous acid to disinfection the environment. For example, the restroom disinfected with bleaching agent every day. And every room, including the clinical examination room, the treatment room, the laser room, we disinfected every day after the working day. And inside the room, every treatment bed, we cover with non-woven fabric. We change after the patient use. And in the registration desk, and also the pharmacy tabletop and the injection station, we disinfected every time after the patient was serviced. And about the stairway railing and the elevator button, we disinfected 3 times a day. Next part is about the pandemic impact to clinical practice. I divided it into 2 parts. First part, clinical dermatology division. This is under the National Health Insurance in Taiwan, who cover more than 99% of the pupils. We take care of the skin care and any dermatological disease. We have a 9 board certificate dermatology to provide this care. This part is a minimal impact by this pandemic. We have about 5 to 10% less patients compared with pre-pandemic period. The second part is aesthetic dermatology division. This part is impacted moderately by the pandemic. We have about 30 to 40% fewer patients compared with before. That's because this part of the patient usually postponed of their treatment due to their fear about this pandemic. So we have a program to outreach to our patients to reassure them our protection, our check and monitor of every patient to enter our clinic. And also because everyone in public transportation or during their work, they wear a medical mask. So we say to our patient, this is a good time to do some more aggressive treatment because the downtime will be covered by the medical mask. It's not noticeable so easy. After this outreach, we have increased 10 to 20% of our patient volume. At the same time, we share our sanitary and disinfection protocol on our social media to assure our customer that the environment of our clinic is safe and clean. In May 3rd, we also hosted a training program for new board certified dermatologists in Taiwan, during which we have maintained our rigorous standard in disinfection, social distance, and contact checking. This was done by the travel history and the temperature taking at the front entry, the seating assignment of adequate distance indoors, and limiting the number of participants for the hands-on session. I hope this information has been helpful for you and your practice. I commend to my colleague and the medical professional over the world for your bravery and service. Stay safe, stay healthy.